This is not my mother's menopause.
This is not my mother's menopause.
This is not my mother's menopause.
Hi, I'm Laura, your host for the series, This is Not My Mother's Menopause, What You Don't Know About Menopause, Hot Flashes, and Night Sweats. This series is about menopause and how it affects women, especially when symptoms of hot flashes and night sweats begin. This is the fourth segment of a 6-segment series that focuses specifically on the diagnosis, treatment, and management of menopause. In the previous segment, we heard from healthcare experts and women about racial and ethnic comparisons as they relate to menopause symptoms. In this segment, we'll hear from our healthcare experts and guests about barriers to care. And we'll hear why American women from different races, ethnicities, and financial backgrounds may have difficulty accessing proper care for their menopausal symptoms. Before we hear from our experts and guests, let's first look at what menopause is.
So what is menopause? A clinical definition of menopause is the natural end of women's menstrual cycles due to a decline in the production of estrogen and progesterone hormones in women. In other words, it's nature's way of ending a woman's monthly menstrual cycle and her ability to get pregnant. You may have heard the terms perimenopause and postmenopause. So what is perimenopause? For most women, perimenopause happens in their 40s. Perimenopause begins several years before menopause. So for many women, this will happen in their 40s, but for some, it can even begin in their 30s. This is the time when ovaries gradually begin to make less estrogen. As estrogen hormones rise and fall, periods grow longer or shorter, and women begin to experience menopause-like symptoms. Menopause naturally occurs in women between the ages of 49 and 52. But the age women experiencing natural menopause can also vary widely from 40 to 58 years old. It also varies by ethnicity. Postmenopause is the time after a woman has been without a menstrual period for 12 months or 1 full year. During this stage, menopausal symptoms typically decrease or stop completely. The symptoms of menopause usually develop in the transition years. The most common symptoms are vasomotor symptoms, or VMS. Of those surveyed, 40% of women report feeling hot or cold. 17% experience night sweats. 16% say that insomnia is a symptom of menopause. 13% of women experience vaginal dryness. Mood disorders affect 12% of women in menopause. And 12% of women also report weight gain during menopause. In all, 85% of postmenopausal women have experienced a symptom in their lifetime. VMS are the most common symptoms associated with menopause, affecting more than 50% of women ages 40 to 64. The most frequently experienced menopausal symptom among whites, Hispanics, and African Americans were VMS. And among Asians, it was decreased sexual interest and increased joint and muscle discomfort. According to studies, Asian women experience the smallest number of symptoms, and African American women experience the largest number of symptoms compared with other ethnic groups. Of those surveyed, 53% of African American women were more likely than white women, 29%, to have experienced VMS. Factors associated with VMS included race, BMI, and dietary intake of fat and calories.
Our first guest, Janet Carpenter, is a distinguished professor at Indiana University School of Nursing. She's been studying menopause for 25 years. Janet talked about some of the reasons women have issues getting proper medical care and information about menopause in the U.S.
We definitely see in low income and even just across different areas of the U.S., we see women's access to care being very differently. So if women can't access care, then they're not getting the treatments that are available for them. So culturally, economically, there are so many different ways that a woman's menopause experience can be affected. Women who report a great deal of discrimination when they see healthcare providers, are going to be less likely to go to those providers and talk with them about their symptom experience and have the kind of relationship where they can really talk through different treatment options and engage in shared decision making about the best treatment option for them. One of the challenges that we have I think in this country, in the United States in particular, is that we don't prioritize women's health in many ways. And so women's experiences by the time they get to menopause tend to be fraught with dismissals of symptoms or quick visits where their questions aren't really answered. They also they're required to see multiple different providers. I'm always still puzzled why I can't get a pap smear when I go get my mammogram, at the same time as I'm undressed anyway. But it's this fragmentation of care that can really affect women. The other thing that happens is that we have really good research that unfortunately shows that providers, physicians, residents, nurse practitioners are not very well educated to handle women at menopause. The curriculum that they go through just doesn't contain a lot of information about menopause. What that means is that they're simply not educated and not prepared to help women. So it's really important that people access what they need to learn to take care of women at menopause. There are some organizations like the North American Menopause Society who has a credentialing program so that people can become a certified menopause practitioner. One of the issues with that, even in the city that I live in, is that our menopause practitioners have retired, and there's not currently anyone that I find when I search that website in my town where I live. And I live in an urban metropolitan area, and so there's likely even more issues in accessing care for women in rural areas or where healthcare is not easily accessible.
When it comes to getting information about menopause, like symptoms and treatments, Janet says that online resources and communities can be beneficial. She explains how this can be another resource in addition to a healthcare provider who focuses on menopause. But as she explains, women need to be cautious and do their research when it comes to taking advice from online resources.
There's a lot of pros and cons to getting information about menopause on the internet and social media. One of the biggest frustrations I have is that when you go on the internet, we have this preponderance of negativity around menopause. And so I think it sets women up for an unrealistic expectation or a mindset around menopause. Another frustration I have is the lack of regulation around marketing herbal products to women at menopause. So those herbal products are not regulated in the same way that the medications that we've tested and shown to work for hot flashes and other symptoms are effective for women. And because they're not regulated, women are trying things that we've either shown through research are not effective or we have no research about. The dosages vary in those products. Some of them we know contain ingredients that interfere with medications that women take, and so they can be downright dangerous for women. And so, there's a lot of misinformation on the internet, and even reputable sources don't have good information always on menopause. We did some research on slow deep breathing for hot flashes, and we showed that it really doesn't help alleviate women's hot flashes and other menopausal symptoms. And around the same time that we published our study, some other groups published similar findings. And yet today, when you go to reputable websites, you will see try slow deep breathing for your hot flashes. And it's misinformation. It's no longer correct. And the problem with that is I think it leads to frustration for women because they see things that are marketed or advertised or that an expert website is saying will work for hot flashes. They're trying all these things and they become frustrated feeling like nothing is really ever going to help them with their hot flashes or night sweats or other symptoms that they're having. A wonderful source for reputable information is menopause.org. It's the website of the North American Menopause Society. There are a ton of resources both for healthcare providers and women available on that website, and it's the #1 site that I recommend to everyone. There are slide sets, there are articles, there are educational programs. credentialing programs for healthcare providers, and there's a lot of information that women can download from that website, and they're created by menopause practitioners, menopause professionals. Another thing on that website, menopause.org, is that there's a list of books and books that have been reviewed by the North American Menopause Society. So that's a really good place for people to go to see what other resources are available beyond those that were produced by the North American Menopause Society.
Our next guest, Edwidge Thomas, shared her personal experiences with what she has observed and experienced as a healthcare provider and as a member of the BIPOC community dealing with barriers to care as it relates to menopause. Edwidge is 60 years old and is a nurse practitioner who lives and practices in New York City. She was born in Haiti but raised and educated in the U.S.
So I've been extremely fortunate because I'm also part of the medical community. So having access to great medical care is something that I've been extremely fortunate to have that. I have many colleagues that are physicians and also advanced practice nurses. So being able to get questions answered, and I myself is an advanced practice nurse, getting access to education and evidence-based education has never been a problem for me. But I'm very aware as a Black female, in New York, that there are so many women that look like me that do not have the same level of access. And I know that because I take care of some of those women. I currently am taking care of patients in a federally qualified health center in Upper New York, and I see a lot of Black and Hispanic women and the struggles that they have, not only related to access, but having access to medical information and guidance and helping with decision-making with the best course to take as it relates to treatment plans. One of the things that I've always decided and thought that it was critical for me to do as part of a member of this profession is that really to dedicate my time to taking care of folks who are underrepresented and underserved. When you talk about access, I think that the generation that's really forcing us to talk about it is making people in my generation talk about it and talk about it with my patients, talk about it with my friends, talk about it with whomever, and no longer feeling embarrassed. And with the hopes that our medical community is also recognizing that there are women who do not have the level of access that needs to understand what's happening to them and needs to have the treatment and all of the different solutions out there to really help them with this journey of their life.
Our next guest is Dr. Koski. His parents are from Macedonia, and his passion for medicine and serving others comes from his family roots. He has ancestors on both sides of his family who are village doctors. He currently lives and practices in Hawaii, a state that sees its share of underserved and underrepresented residents, especially Hawaii's female population. Dr. Koski shared his observations and recommendations for improving access to any woman who is looking for health care and information related to menopause. He says one example to removing the lack of access to a healthcare provider is to make telehealth more readily available.
When we're talking about inequalities in healthcare, and if we focus on women, there are many. And those, in general, are due to inequalities in the healthcare system. The healthcare system is designed to take care of everyone, but sometimes people fall through the cracks. And I think this happens to women a lot. So women are a lot of times, first and foremost, because of some of their issues, they have difficulties representing themselves or discussing these problems with the physician. Majority of physicians are men still, and I think they're uncomfortable. And so some of the inequalities related to them being more able to discuss their personal issues would be having more female physicians. And then also, women tend to be in a situation where they have problems because of their financial inequalities. So having financial inequalities leads to having poor or no insurance, and having no insurance or having inadequate insurance also leads to them not taking care of themselves adequately from the aspect of getting their routine things done and focusing on major problems that they might have. In Hawaii, if we focus on the most populated areas, we can see inequalities due to the fact that, yes, there's a lot of access to care for most people, but those that have Medicaid have the hardest time getting access to care. And if we see issues that arise because of that, that would be related to them primarily not taking care of simple things like their hypertension or their diabetes or other things that would lead to other problems if not addressed in a timely manner and in a systemic manner. But if you look at the outer parts of the islands, due to the fact that there's even less access to care, then those problems are even more on the rise. And then if we look at those populations that are on these parts of the island, they have most of these healthcare problems that need to be addressed, like hypertension and diabetes. And so all of that would make it even more of an underserved area due to the fact they don't have access to care and they have the biggest need. There are new solutions to getting access to care, and one of them being telehealth. You can talk to a doctor within 5 minutes, or you find a service that provides these kind of aspects of care. And that should lower your inabilities to see a doctor.
We've spent this segment learning from our experts about the barriers to care that women throughout the U.S. experience related to menopause care, treatments, and information. In the following segments of this series, we'll examine misinformation and stigmas, treatments and therapies, all pertaining to menopause. When it comes to understanding this transition in a woman's life, our goal is to help our audience have a better understanding of what menopause is, and it will help women make better choices when it comes to the management of their symptoms and overall physical and behavioral health throughout this stage of their lives. Please join me for the next segment in this series. We'll see you soon.